Grosseteste was also interested in medicine, which is the next great discipline we have to look at. And as I mentioned earlier, medicine in this period was at a disastrously low ebb in Europe. There's an indication of this in an anecdote narrated by a Syrian knight who participated in the Crusades, a certain Osama ibn Munqidh, who also worked as a physician. And he said that he once encountered a Frankish knight who had an abscess in his leg, and so Osama goes in and he knows what Razi and Ibn Sina have prescribed for this, which is a kind of herbal poultice, and he slaps it on. And then in comes a Frankish doctor, and the Frankish doctor takes one look at this and says, do you want to live with one leg or do you want to die with two? Of course, the poor knight says, well, I'll live with one leg. And without further ado, the Frankish doctor pulls out a sword and starts bashing away at the leg until he's removed it. And of course, the man dies from loss of blood pretty promptly. And this is, whether the story is true or not, it indicates what was a very real and huge disparity in the standard of medical practice between the two cultures. And the Crusaders certainly recognized this, and increasingly, once they'd been in Palestine for some time, they would make sure that they went to Muslim or Jewish doctors rather than to their compatriots. I mentioned a little bit earlier about hospitals in Europe, and that really they didn't exist as such in this period. The most that you would find would be dispensaries and clinics attached to some of the monasteries, particularly the Benedictine houses, Salerno and also Montpellier. Montpellier becomes a kind of nucleus for the transmission of medical science and hospital practice to Europe because, for various reasons connected to its commercial importance, it was a centre for the settlement of Jews and also Arab Christians from Spain. So it becomes a bridge. But this all takes place against a kind of social prejudice against doctors and particularly against surgeons. The surgeon was regarded as a man as a very low social standing, a kind of like a barber, somebody who dealt with other people's flesh. And as late as 1163, we find an ecclesiastical decree forbidding instruction in surgery as part of the medical curriculum. However, once translated books of Arabic surgery start to circulate quite freely in Europe, this attitude starts to change. Another factor in this change was, of course, the Crusaders coming back from Palestine who had their own experience of the Saracen skill in surgery. So in 1252, we find the first significant European work on surgery. A man called Bruno da Longoburgo who writes a manual of surgery called the Chirurgica Magna. And this is basically just a translation of snippets from the great Arabic works, particularly the work of Zahrawi, the writer on surgery from Cordoba, who's the picture of whose instruments we've just been looking at. He's the principal source for this book on surgery. And it's also thought that the first, as it were, dedicated hospitals in Europe come into being following the Crusades. From about 1200 onwards, we don't have an exact date for the foundation of Europe's first hospital, but from about this period we start to find institutions established whose sole purpose was to heal the sick, rather than being wards or clinics attached to other larger institutions such as monasteries. However, still the standard of organisation and also the scale of these operations fell considerably below the standard in the Islamic world. So that, for instance, Europe's first hospital with a resident physician was not established until the year 1500. Remember, I mentioned this place called Al-Mansouri in Cairo, which had several resident physicians, which was not at all unusual at that time. Another Arab practice, clinical instruction in hospitals, so that students would actually see the sick and learn, as it were, on the job rather than learning in an abstract lecture hall environment. This was a tradition that the Arabs had maintained for several centuries. It was not copied in Europe until the year 1550. Again, the publication of medical textbooks offers another proof of the almost complete reliance of medieval European doctors on the Arab science. First book on medicine ever to be published in Europe was a commentary on the 9th book of Razi's great thing, the Continens, Al-Hawi. But the most significant publishing event in the medical world was the publication in 1473 of the great Canon of Avicenna, a book which it's realistically claimed is the most studied book of medicine in history. There was some reliance in Europe on Greek medicine, text translated directly, Hippocrates, Galen, Dioscorides, and so forth. But the great preponderance of Arab influence is revealed by the fact that in the works of the leading medical physician of Italy, a certain Ferraro de Grado, we find, and some busy academic has actually totted up this and quantified it, that in his books the works of Avicenna are mentioned more than 3,000 times, while Hippocrates appears over 100 times. So that's some quantifiable evidence of the weight of authority that the medievals attached to the Arab as opposed to the Greek medical heritage. That's really all I think I should say about medicine.